Today we're here for a joint training between the Department of Public Health staff that work with families in maternal and child and adolescent health and our partners in the parks departments, and we're focusing on the importance of nature to people's health. We work with families that don't have access to the parks and other kinds of important resources for their health.
Today was monumental for the simple reason that this is the very first time anywhere in any city that an entire health department has adopted park prescriptions for all the people who use their services. It is our goal that we reach communities that don't traditionally visit national parks. So the extent to which the health department helps people come to parks, that fulfills our mission of reaching exactly the people we hope to reach.
The San Francisco Department of Public Health is one of the most innovative public health systems in the country. There are 9,000 employees, and today we got to meet 160 of them. And so from them, they're going to be the really true champions to be rolling out this concept of park prescriptions, turning it into reality, and starting to prescribe nature and parks for their patients.
I truly believe that park and recreation agencies need to follow the model that's being developed here today to step up and basically transform communities by maximizing the utilization of the facilities and resources that they steward.
Well, these parks belong to everyone. We feel like we have a special obligation to be a welcoming place for everybody in this region. Today's training for the San Francisco Department of Public Health was hugely important in the park prescription movements because it demonstrated the enthusiasm of the health professionals, and they're enthusiastic about having parks as a place to direct and encourage their patients to come for health.
One of the best ways to really understand what nature and parks can do to improve the health of our population here in San Francisco is for our providers to really get into the role of what they do every day. And so today we had a room full of providers from mental health providers, social workers, Black infant and child health care, the whole gamut of the most vulnerable populations. And so they were able to really look at exact examples that they're used to working with every day and showed them different tools that they could be using to really improve the health of their patients.
I was pretty excited to learn about the different programs that were offered and the times that were offered, and I'm really excited to get back to my job and be able to provide that information to my clients.
I was really proud of listening to our staff. They're really able to incorporate the broad concepts of linking parks and health together. And just hearing the parks be receptive and excited about actually hosting a convening of families, I think that's just an example of agencies and organizations working together to improve people's well-being.
You are our ambassadors. The fact that through this training and through the future work that we're going to do together, that you are going to be encouraging people to get out and play, to visit one of our city's most amazing parks, and you get to say, you know what, you've got one, you've probably got one within a 10-minute walk. So go there, use it, enjoy it, be healthy, choose health.
It's very important to help families build memories, and I think that the park system is an excellent place to start.
I think when you're in pediatrics, you really care about the future of the earth. So for me, the future of park prescriptions will be less of a park prescription and more of a seamless integration of nature.
I've been working with these folks for the last 3 years on this movement, and to see it come together, to see parks and health, literally doctor rangers come together to really show that this is something that can really take off. And this is a new way of looking at our healthcare system. This is a new way to keep parks and nature relevant for the next generation.